Let's have a look to some soft tissue mobilization techniques which can be helpful in the rehabilitation of a painful stiff foot. Before working on the joints, let us work on the soft tissue, massaging, mobilizing, stretching the calf muscles. In particular this part here. I go deep in it so that I stretch as well deep connective tissue. Around the tendon, the Achilles tendon, I'm mobilizing the peritendinous tissue, the tissue around the tendon. A helpful technique sometimes is the mobilization of the insertion. I relax the whole muscular and tendon system by putting the foot into plantar flexion, and now I'm mobilizing the insertion of Achilles tendon. I mobilize it until it is soft, flexible and pain-free. As well that tissue around the calcaneus bone. Go deep into it. It should move and be flexible. Very often in chronic tensions and inflammations we will find a stiff joint and stiff soft tissue here. So you go deep into it and you mobilize it in a relaxed situation. On the anterior part, I mobilize nicely the tibialis muscle, anterior muscle. I mobilize it transverse. I go with deep strokes longitudinally into that sulcus between tibia and muscle. It should be soft and pain-free. And I can use the skin rolling technique and I go deep on the fascia to mobilize. There should be no pain, no adherences on that movement. If I can feel some painful spot, I just go on rolling over this tissue until it gets free. On the sole of the foot, it's always good to massage, to make it more soft, to make it more free, this part of the foot. I massage in lines, the medial line, central line, lateral line. While I'm holding with one hand, the other one is massaging, and I really go deep into it. Sometimes you will find painful spots. There you just massage gently, but you insist. Particularly here you can find sometimes pain and swelling. If there is swelling, just move it out, shift it behind malleoli. And the last soft tissue technique, between the metatarsal bone we have these spaces, intermetatarsal space, and I massage these muscles. I go deep into it, beginning by the head of the metatarsal bone, and slowly I move to the tarsus, the center of the foot. When you find a painful spot, as now, just identify that spot. Sometimes it's just a little spot. And there you work gently with circulatory movements or deep friction transfers to the muscle. It is worth to take a bit time and working nicely on these intermetatarsal spaces. Then we are coming to a non-specific movement. I mobilize the head of metatarsal bone. I do it more on the lateral, more in the central part, more on the medial part. Another technique with both hands, I'm grasping here at the metatarsus tarsus level. I do like this. You really grasp the foot and you mobilize it. And you can move towards the fingers and you can move back to the ankle. Mobilization, non-specific mobilization of tarsus and metatarsus. You can do a distraction as well. I hold and I pull. I pull now on the part of the inner side. The same, I can change my hand and I pull on the outer side. A very helpful mobilization is forming the arch and opposite. Forming the arch, opposite. Forming the arch, opposite. Forming the arch, opposite. Another helpful technique, I'm holding the calcaneus, so I'm blocking the upper ankle joint and I mobilize the lower ankle joint with rotation. On one side, on the other side. I push the foot, the center of the foot, into a half moon shape and then the opposite, so that I open up this part. With two fingers I squeeze against. On the fingers we have similar techniques like the hand, so I just pull, distraction. Or the anterior-posterior movement. And I can do that on all these little joints too. Let us remember, we have as well a rotatory component of the movement. Passively we can do them and it is helpful for the flexibility of the foot. So rotation movement we will do passively. To stretch out the sole of the foot, I first stretch up the fingers. When they are really up, then I'm coming up with the foot. And I will produce a good stretching down here. So first the fingers, all fingers up, and then I'm coming up. That's some helpful techniques for everyday mobilization of the stiff foot.